Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Clinic, Istanbul, Turkey. Today, differently from our previous video evaluations and the result comments, we'll be evaluating the case of the patient who underwent a facial hair transplantation or beard transplantation surgery in our clinic. This is a 25-year-old male with the previous medical history of delayed growth or non-growing areas in the cheek, sideburns, jawline, and under the jaw areas of the facial part. He had some growth of the mustache and the goatee area, but the rest main of the areas were really open. The facial hair transplantation or the beard and mustache or mustache transplantation are really good surgeries that improve the quality of the life and self-esteem really nice. So the patient had a surgery with 4,100 grafts. With 4,100 grafts, we restored the sideburns, the cheek area, jawline, and under the jaw areas. One of the biggest misconceptions we have with the beard and mustache transplantation, the patient asks us to implant the grafts with the specific shape of the beard they share with us. The point is that when we do reconstruction of the beard area, we build a kind of frame for the beard, so you can design and cut it according to expectations, because today you may want to wear your beard short, tomorrow you may want to wear it longer, or you may want the different designs. So that's why it's very important for the patient to know that we should rebuild the frame of the beard, and the design and the beard cut the patient have will give it the necessary shape. So you can see we followed up with the natural lines. One of the most important points during the beard transplantation is that we must fill up the under the jaw line here as well, so the transition from the lower part of the jaw to the cheek side becomes very natural. So the patient was transplanted 4,100 grafts. Main area was the cheek, sideburns, jawline, and under the jaw areas, but we also reinforced the goatee area a little bit as well and made the connection between the mustache and the lower part of the beard as well. You can see the result of this patient 1 year later. You can see the face is completely reframed. He had a really nice growth of the beard on the facial part. He's happy, we are happy. One of the questions also we get from the patient is that how many surgeries we may need. Here is the point. Most of the time, depending on the number of the grafts that the patient needs, of course, a single surgery are pretty enough for the beard transplantation, but every once in a while, after framing the face, the secondary surgeries may be needed to add more density to this area, but it's decided according to the patient's expectations and, most important, number of the grafts we are able to get from the patient. The patient is happy, we are happy, the patient has got what he wanted. His beard looks very natural, very organic. Also, during the beard transplantation, one of the biggest mistakes we see outside is that the angle of the incisions are really different. The incisions in the facial part, especially in the beard area, should be done with a very low angle, close to zero actually, at max 1 to 3 degrees. So the beard should be growing in downward direction, so it gives the natural outlook. If the angles is more steep or the angle is slightly different, the hair tends to grow in a vertical direction. Sometimes we call it the hedgehog style. It looks very unnatural, very problematic, and it's really hard to fix it. The patient may have to go under a couple of surgeries to restore these issues. Thanks for watching us. If you have any questions or comments regarding this case, you can leave them under this video. Stay tuned and we'll see you later.